Hello everyone, I'm Dr. Cristian España, and I have an interesting case imaging from a COVID-19 patient. I'm from Danbury Hospital, and this is Focus Bites. This is the case presentation. This is a 57-year-old man, no past medical history, who came in because of laborious breathing, fever, and cough for 9 days. He works in a pharmacy. No smoking, drinking, or using any illicit drugs. He has no past medical history as before, and he's not taking any medications or any supplements. Was tested 3 days before, came in and was positive for the newer coronavirus. The patient was doing fine until his wife basically said that he needed to go to the ED, and he was found slightly hypoxemic, 89 on room air, and was placed on oxygen. His physical examination is not very relevant, significant. Uh, the BP was 110/50, heart rate was 97, respiratory rate was slightly increased, the O2 sat was 94 at that moment on 2 liters of O2. Looking comfortable, nothing in the physical examination except for really minimal crackles over the right lower lung. Heart was normal, abdomen was normal, extremities no edema. The labs were significant for lymphopenia. The patient did not have any other abnormality in his labs, no leukocytosis or leukopenia. The LDH was 889 and AST 88 units per liter. All other available labs were within normal limits. This is a chest x-ray, and chest x-ray does look a little bit whitish. It's an anteroposterior portable and does look a little bit whitish, but it's interesting here. There is some ground glass opacity with probably a little bit of airway disease, and then here a little bit of ground glass opacity again, maybe resembling atelectasis, linear atelectasis, and here a little bit of ground glass opacity with alveolar disease. So I decided to perform an ultrasound on this patient who didn't have really findings. And the ultrasound from the right lung base when he was sitting up is this. And you can see that there is a little bit of fluid in between the parietal pleura and the lung pleura. And however, the pleura is moving well. The pleura is thickened. You can see that it's very thickened, and there are multiple B lines that are very solid, just like the B lines that we see in common pneumonia, or or mostly in common pneumonia. They are different from CHF because they are not flickering. Sometimes you can also see this type of B lines in some fibrosis of the lung. A little bit up to spaces up, also in the right lung, we can see that I really can't differentiate where the lung starts and whereas tissue seems like a C pattern, and you can see this in patients with ARDS and fibrosis. And then I just wanted to remind you the anterior zones. If you want to see how a normal ultrasound looks, please see my prior video. I'm gonna put it at the end of this video, and so I'm gonna show you the most important images that I have. And the first one is zone 1, and here we can see that I cannot really see where the pleura starts and where is not the pleura. I can see a big B line. I believe this is a pleura that is barely moving, and you can see that the space below looks consolidated, and this is zone 3. Here again, we can see the pleura. Pleura is moving a little bit better. It's very thick again. This is very easy to see. And there are like massive B lines below that are not flickering. And this is very common to see in patients, again, in ARDS or pulmonary fibrosis. Then we have this one, which is in zone 4. And you can see the pleura moving. And basically I don't see A lines. Interestingly, in this patient, despite not having much, I never saw an A line in any place of this lung. So seems like the lung was like pretty much affected. And then in the contralateral lung, I can see in the zone 5, again the pleura is moving, I believe a little bit less than the normal. It's a little bit thick, and we can see some small B lines, uh, mostly flickering, probably from early consolidation. The status or the volume status of the patient was normovolemic, no signs of hypervolemia, and actually I believe he was a little bit dehydrated. Um, so it's interesting that COVID-19 is giving us images that sometimes are consistent with pneumonia and fibrosis, and these abnormalities are generalized despite the findings of the chest X-ray. Um, this can be a clue to think of COVID-19 if you don't have the means of CT scan, and or the means of testing at that moment in a classic patient. This can help you diagnose. Um, so this is what I have for you today. This, of course, is still very early. We don't have big studies. Please remember, this is just my experience and just a case presentation. So give us a thumbs up and follow the channel. I'm gonna put here the other videos that you can see. Thank you very much.